Moms around the country, they're paying attention to this next story after a Netflix star goes public about her breast milk mishap with the TSA. Emily Calandrelli of Netflix's Emily's Wonder Lab took to Twitter to share that she had made plans to pump before boarding her plane. But then she was told by the TSA to check the ice packs meant for her breast milk. She also claims 2 agents raised a red flag because the packs were not frozen solid. Joining us right now, board-certified OBGYN and Chief Medical Officer at Verywell Health, Dr. Jessica Shepard. First of all, I have to say, good to see you. We go way back.
We do. Good to see you, Adrienne.
Let's touch on this big story of traveling moms who just want to get their baby milk, their breast milk and their breast pumps through TSA. The TSA does have an official statement that they've shared with NewsNation, so we want to share that first. They say that breast milk is allowed on planes after the proper screening process. Breast pumps are seen as medical equipment and therefore allowed as carry-ons. And if medically necessary, gel ice packs are permitted, whether melted or slushy. Though, if they're slushy or melted, you might be going through an added security pat down or something. They didn't say that, but I just think, they've alluded to that. Are there inconsistencies surrounding what the TSA says is correct to do for a mom?
Well, I think that when we think of breast milk, that is like liquid gold. I've been in those instances myself where you're traveling with breast milk. So I think taking into account where the sensitivity is that that's something that's very precious. Now, looking at the TSA and what they have, I also looked on their site and they do talk exactly like you said about medically necessary gel ice packs, melted or slushy. However, if it's an ice pack or a freezer pack, those need to be frozen. And if those particularly are not all the way frozen, there is a chance that they may not necessarily go through the check-in process and need to be checked in. So I think that there are some inconsistencies between what constitutes these gel packs versus a frozen pack. One can be melted, one can be slushy versus one has to be completely frozen. So I think that can cause some type of miscommunication, especially when traveling. And then the other thing too is what is the communication that is shared with the person specifically when they have a medical need such as breast milk, and how is that translated to the patient in order what needs to be able to secure that breast milk? I think ultimately when we look at it, it should be this concerted effort to make sure that the breast milk is kept fresh and as cold as possible, and finding ways and alternatives to help someone in that instance when they have such a need.
Yeah, there is a sensitivity that needs to be expressed here because it's just what moms need to do, especially if lactating and needing to pump. Do you have advice for moms who are traveling for kind of taking some of the hassle out of all of this?
Yeah, I actually do. And again, this comes from personal experience is yes, trying to use frozen packs. And if they are taken away, we've had travel where I've had to have the extra security to look at the breast milk, never had it taken away. But for the freezer packs, I always had the alternative of if it's taken away to make sure that I immediately go somewhere where I can get some ice after going through security in order to get the breast milk back on ice. Now, relatively, when we think of breast milk, there is a time frame in which it can last outside of a fridge and not frozen. And so really looking at those time frames is really important for moms, however they're traveling. It really doesn't necessarily mean just for air travel. It could also be just traveling in a car for a long period of time. And really looking at those hours, because many times breast milk sometimes is thought to have gone bad. But really when you look at the time frame, it actually can be preserved and kept cold and not thrown away, which is what we all don't want to do.
No. I think that I can understand why a mom would be a little bit perturbed if that happened to her through the TSA checkpoint. Dr. Jessica Shepard, thank you so much for being with us.
Thank you so much, Adrienne.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.